Hello class, my name is Crystal Robinson and this is my presentation of Communication with Autism, Effective Interventions for the Classroom. Autism spectrum disorder is defined by deficits and developmental delays. One of the most common deficits is the ability to communicate. This literature review examines the studies of behavioral interventions used for young children with ASD at the preschool and elementary level that help improve their ability to communicate. The purpose of the literature review was to answer the question, what behavioral interventions can early childhood teachers use in an inclusive classroom to meet the communicative needs of young children with autism? I use the following terms when researching the topic: autism spectrum disorder, communication needs, behavior interventions, and an inclusive classroom. These databases were also used to find studies: ERIC, Teacher Reference Center, the Professional Development Collection, PsycArticles, and PsycInfo. ERIC yielded 326 hits, Teacher Reference Center yielded 2 hits, and a collection of, or a combination of the Professional Development Collection, PsycArticles, and PsycInfo yielded 1,042 hits. For the purpose of my actual study, I only used the ERIC database. In order to measure the quality of the research studies reviewed, 3 criteria were used. Is it a research study? Is the effectiveness of the intervention assessed, and do the results improve the child's ability to communicate? And does the research study include interventions pertaining to ASD or a developmental delay? The first study was based on an intervention that is called a pre-linguistic milieu training. The results indicated that the teacher was able to implement the intervention and showed increases in all the intervention strategies. The child increased his rate of intentional communication, eye contact, vocalization with consonants and conventional gestures, and the participant was the special education teacher and a 3-year-old boy with severe communication and cognitive delays. For the second study, the intervention was known as Advancing Social Communication and Play. This intervention had a positive impact on social communication and play skills for the 3 preschoolers who were the participants, and it showed either an increase in frequency or more stability in the target behaviors. The next study intervention was the Picture Exchange Communication System. 84 children from 15 schools participated in this trial study. 73 of them were boys and 11 were girls, and they were between the ages of 4 to 10. And overall, PECS appeared to enhance the children's spontaneous communication for instrumental requesting using pictures, speech, or a combination of both. The next intervention was called JASPER, Joint Attentive Symbolic Play Engagement and Regulation. The participants were 15 school-age children with autism who were recruited from non-public autism specialty schools. And the results provided further support that even brief targeted interventions on joint attention and play can improve core deficits in minimally verbal children with ASD. The next intervention or study was social cue cards. 3 male students who were in preschool, they were diagnosed with autism or pervasive developmental disorder, and the results indicated that social cue cards were effective for improving the rates of social communication behaviors for all participants. In addition, all 3 participants demonstrated maintenance of the skills after a 2-week follow-up. The next was a modified milieu therapy and functional communication training with 3 male preschool age students with autism, and the age ranges were from 4 to 7 years, and the children maintained communication and low rates of aberrant behavior and generalized their communication from the home to the classroom. And based on the research studies reviewed, there are many interventions that can be implemented to support communicative needs of students with autism. PECS, JASPER, milieu therapy, picture cue cards, and pre-linguistic strategies are among these behavior interventions that teachers can use in an inclusive classroom. In my opinion, there needs to really be a combination of these strategies along with other good teaching practices, and that's the best way to support these students. I also think that a pull-out would be an appropriate instructional placement for the students as well. The studies research all provided information that can be used in educational settings, clinical settings, and in natural settings like the child's home. So with these strategies, depending on what they are or which one you're using, it could also be used at the home of the child. The limitations of this research study were that it was a class project. Only 6 interventions were reviewed, and there are definitely more that could be looked at, and I only used one database. And there's definitely a need for future research of this topic. General education teachers who provide support for students with disabilities in an inclusive classroom need the necessary training to effectively teach. I know personally I've been in the general education classroom for many years, and I've serviced students with autism and other disabilities, and I don't feel as though I've received the appropriate training always to work with these students. So future research definitely needs to be done so that general ed teachers can provide the necessary support for students with autism and other disabilities. And that completes my presentation. Thank you.